Happy Migraine Awareness Month, everyone. We are talking to people who are thriving with migraine this Migraine Awareness Month. And joining us today is a guy that I have been a big fan of for a very long time. That has been Harris-Roxas. He's a health researcher and specifically looks at how people get lost, you might say, in the health system. Thanks for joining us, Ben.
G'day, how you going, Kat?
Doing really well. So tell us what it is that you do at UNSW, the kind of research you do.
So really what you said is a good introduction. I'm a health services researcher. I look at essentially, integrating care. So primarily between general practice and other health services in the community, but also, hospitals and specialist care, and also the groups that more systematically miss out in that sort of situation. So I guess I'm interested today because a lot of people who experience migraine know about that sort of experience of disintegrated care, the gaps that can exist between healthcare services, specialists, organisations, but also more generally social care and so on. And everyone watching this, you feel like you often have to become experts in your own health, your own conditions, the system itself. And so really a lot of what I do is trying to come up with, I guess, small but meaningful enhancements to that so that people can, I guess, both be empowered in a bit of that sort of, being expert in their own care journey, not that everyone should have to be, but also what are the practical things that can actually bridge some of those gaps that divide. So
this is about getting your GP to talk to your specialist better, to talk to your allied health professionals better, to talk to your social welfare type services better, so that we don't have to keep repeating the same stuff every single time.
Hopefully. And one of the big challenges has been the idea that people have that things like a shared medical record would be the solution, but as we know from the My Health Record sort of challenges, the way that works in practice is not always so great. So I'll give you a really tangible example of what I'm doing. We're looking at working between mental health services. So this is for people who experience more severe mental health issues. How can they work with the mental health services they receive, the people themselves, but also their general practitioners about their physical health problems? Because, what's leading a lot of people's, really significant ongoing illness and deterioration is not so much even the mental health condition, it's often their physical health that gets largely ignored. So we're working on this system that instead of sharing records in a sort of like a way that no one looks at, we're trying to come up with a system that's more like an interactive shared task list in a sense, sort of with reminders done through SMS, through a website and so on, that moves everyone from sort of like having access to info to actually thinking, how do we work and undertake activities as a team, and really with the person themselves kind of at the center of that. So it's the kind of thing that you'd think should be happening, should be straightforward, but often these things bridging the gaps show up some of the tensions, the sort of the big inadequacies, and really the sort of often the funding sort of tensions between the way we work in health systems and so on.
Yeah, so there would be some obvious kind of candidates for people who get left out. So that's usually people of color, people with mental health conditions, people from poor socioeconomic background type things. But do you see any differences between disorders? Like, say, for example, I mean, migraine's a really great example of a condition where there's nothing, right? There's no support services, there's no coordination, there's no plans, there's nothing, no national strategy. If you compare that to something like, say, breast cancer, where there are lots of documentation, lots of services right down to your breast care nurses, is there a lot of disparity across the health system between disorders?
I think there is. And what's really, I mean, there's a couple of things that sort of, sprang to mind as you were just asking that question. One of the things is that it's not the conditions or disorders that are, receive the most attention are often the ones that get the most sort of supports and are most organised, aren't necessarily the ones that are most common, aren't necessarily the ones with the most need and so on. So it's often about who it affects and are they in a position to, I guess, have a degree of control, influence, networks that they can draw on to sort of start organizing, to start asserting that control over the help they receive and so on. So I think breast cancer is an interesting example where it affects a broad swathe of women from across a whole range of, strata of society, but also those people have also been very effective at managing and organising the response to that. One of the challenges, I think, with migraine, as an example, is, the perception that it is a women's health sort of issue is a really tricky one, in the sense that it does disproportionately affect women. But the effect of that is that it often gets consigned, unfortunately, and it's bullshit, but by medical and other groups as a sort of women's health issue, which, we've got to push back. I mean, that's nonsense anyway. We've got women's health issues are significant and deserve attention. But, the other thing is also, apart from being nonsense on its face, it also sort of negates the visibility and the sort of, creates that stigma around men who experience migraine as well. So I think, migraine is an interesting one because it is also so widespread. The Global Burden of Disease study that came out last year, and you would know this better than anyone, said it is the second most common cause of disability worldwide. I think second only to back pain, and amongst younger women, it's the leading one. So it's like this enormously common, widespread condition that flies under the radar. So I think, there's some interesting stuff there about who it affects and some of the, stigma that might associate with it, and how that plays out in terms of what conditions get sort of, well-resourced, well-supported, have mechanisms to organise and so on. So that's why I think what, Migraine Australia has been doing is so important, because it's really highlighting the issue, but also, making sure it doesn't get lost in the mix as well.
Yeah, well, thank you for that compliment. But let's talk about you and your migraine. So what's your migraine like? When did it start?
Yeah, so I had my first migraine when I was 13. So I was in year 7. And so it sort of started with puberty for me as well, weirdly. I know that's the trajectory often for a lot of women, but for me too. And just same out of the blue. I get more classic migraine with lots of visual aura, so sort of like lots of splotchy sort of color stuff, just feeling really, that sort of intense generalized pain, like someone's cracked you over the back of the head with a baseball bat sort of feeling.
Yeah.
And, a lot of photosensitivity and so on as well. So really sensitive to sun while it's sort of coming on. So for a while it was really, and also I get a bit of word salad and so on. So, it's interesting for a while, I get the full sort of barrage of really getting knocked out of action.
And for those who are watching this, who aren't kind of, within the migraine community, this is really common, right? What you just did, and I get this, and I get that. And, but dismissing these other symptoms is one of the reasons we talk about most bothersome symptom, because generally we seem to talk about the one symptom that bothers us the most, but there's usually 5 or 6 or 7 or maybe 15 others. So it is a really complex disorder, but do go on. And
I think, so, really the thing that works when I'm in that state is it'll progress for a while. I'll get nausea and vomit and then feel better. Often it's after a time in a dark room. So it took me, quite a long time to recognize some of what we call those prodromal symptoms, of things coming on.
Yeah.
That took a long time for me to sort of wrap my head around. And in fact, it was probably in my mid-20s and early 30s that I experienced it most, and I didn't recognize. It took me a long time to recognize what was happening when they were coming on, but also, what was maybe exacerbating or triggering it. And so, in my 20s and 30s, at some stages, I was getting them maybe twice a week and so on. And I went on things like, various preventer type medication and so on to mixed effect. But I found actually the thing that's been most useful for me is actually coming to grips with I guess it's sort of the idea of self-management, or, you know, in the field that I'm in now, they sort of talk a bit about this self-care stuff that I had to come to grips with. You know, it was some of my triggers weren't things like, you know, food or environmental. It was often, you know, stress, mood related stuff, not sleeping enough. These are the things that people will recognize, you know, who are watching. But you know, really coming to grips with that took me quite a long time, and recognizing the importance of those things. And when it's coming on, to take pretty quick action. I'm one of those people that, of everything, you know, bombarding it with a bit of aspirin and, you know, caffeine really does the trick early in the piece. And you'll hear that from others, like a subset of people who experience migraine, that works reasonably well. I'm sort of fortunate that that's the case. So I've got to be on top of it. And that sort of knowing yourself, your condition, and the role you can play is really important actually in the professional work that I do. This idea about how we can actually get people to get that understanding of their own conditions and the role they can play, and navigating this complex, messy system in a way that doesn't sort of say, hey, it's just down to you and it's your responsibility, but it's how can you be part of the mix. And, you know, recognizing that not everyone has the, I guess, that sense of empowerment or, you know, awareness or knowledge or the ability to assert themselves to be that kind of, you know, person who manages their migraine all the time and so on. But what can we do as, you know, professionals or organizations to support people so that that becomes the norm rather than the sort of the thing they have to fight for? So I guess that's sort of how I can relate through my own sort of migraine experience to what I'm trying to do professionally as well.
Yeah. Did you have migraine in the family?
I did, yeah. So my mum has always had it. My sister has it, and they all have pretty similar type of classic migraine sort of stuff. Yeah, and even my grandmother. So yeah, it's been in the family. Not everyone gets it, but yeah, it's sort of so far none of my kids have experienced it. But you know, it is one of those things that's funny. I do think, you know, we talk about the importance of listening to the experience of people who've experienced these conditions in other aspects of health. I think migraine is one of those things, unless you've sort of experienced it, everyone who's watching would know. They think it's bad headache. Yeah, okay. And a bad headache's a big deal. Headache in general is a big deal, but it sort of feels qualitatively different as well. You know, it's a different thing, you know.
Yeah. I mean, one of the things we say all the time is if you don't get it, you don't get it. So it's, you know, it is one of those things you kind of, you know, have to live with to really understand what it is that we're talking about. So it's really great that people like you who have an understanding are both working in the health field where we can make a difference and are willing to talk to us about it. Is there anything exciting coming up in your research field that might be of interest to people with migraine? Got any migraine research coming up?
I don't, but actually, you know, in talking to you and just thinking in the run up to it, I think maybe making a bit more of an explicit connection between some of the things I'm doing in, you know, this self-management space and actually migraine itself would be worthwhile. So this discussion's been a useful prompt for me, actually. I think also, I recently did some work with some people, more than 35 people from across the country. We worked with the Mitchell Institute at Victoria University to come up with what we called a policy blueprint for self-care. And if people Google that, they can find it.
Yeah.
Or it's listed on my website. So if you go to unsw.to/Ben_HR, you'll find this policy blueprint. And it's a blueprint for self-care. And really what it's talking about is not just for action for individuals, but what would make a difference if organizations and health systems really embrace this self-care agenda. And I think looking at that document from a migraine perspective would actually be really useful. It might give some ideas for different kinds of action we could take, but also bring the migraine lens on it as such a widespread condition that really, you know, affects so many people, would actually be a really useful way to think about how we could move that agenda forward. So it's been this discussion has been a useful prompt for me, actually, to think about that as well.
We'll go and check it out, and I'll put a link to it underneath the video. Thanks, Ben, and have a great Migraine Awareness Month.
You too. Thanks.